Let me ask you something. What's the right thing to do when a single decision could save one life, but maybe cost another one thousands of miles away? That's not a riddle. That's the daily reality in global health. It's a field where ethics aren't just theory, they're literally life and death choices. Today, we're going to dive into the moral compass that guides these impossible decisions. So let's start by putting you in the hot seat. Imagine you're in charge. A deadly pandemic is sweeping the globe, and you've got a limited supply of life-saving vaccines, just enough for a fraction of the people who need it. Who gets it first? Do you prioritize healthcare workers, the elderly, the countries that are hit the hardest? This isn't some textbook problem, right? This is the kind of impossible choice that defines global health. Now, to even begin to navigate those kinds of choices, we've got to be on the same page about what we're actually talking about. Global health. It's not just about doctors and medicine. It's this massive worldwide effort to understand and solve health problems that frankly don't care about borders. In the endgame, the ultimate goal, health equity for everyone, everywhere. So how do people in the field even begin to make these calls? Well, they don't just wing it. Professionals rely on what you could call an ethical compass, a set of 4 core principles that are designed to guide them through even the murkiest moral dilemmas. The first point on our compass is justice. And really, this is all about fairness. Let's go back to that vaccine problem. Justice asks, how do we hand out this incredibly precious resource so that the benefits and the burdens are shared equitably? It's about actively working to fix the imbalances that already exist, not just shrugging and accepting them as the way things are. Next up, we've got beneficence. Now, this one sounds simple, but it is absolutely crucial. It's the core idea that any action you take has to actually do good. Good intentions just aren't enough. The things we create, whether it's a new drug or a public health campaign, they have to have proven benefits. And just as important, they have to cause the least possible harm. Our third principle, respect for persons, is fascinating because it's really all about power and partnership. What this means is you can't just parachute into a community and start imposing solutions. You have to honor the autonomy, the independence, and the culture of the people who live there. They have a right to make their own informed decisions about their health. And that takes real work, clear communication, getting consent, and working with communities, not just on them. And finally, there's equity. Now listen up, because this is a big one. Equity is not the same thing as equality. Equality is giving everyone the exact same thing. Equity, on the other hand, is about giving people what they need to have the same opportunity. It's about rolling up our sleeves and actively dismantling the barriers that keep the most vulnerable people from getting the care they desperately need. Okay, so we've got this ethical compass, but who's actually holding it? Let's take a look at the key players, the architects who are making these life-altering decisions on the global stage. It's a huge, interconnected network, really. You have the massive international bodies like the World Health Organization, or WHO, setting the big guidelines. Then you've got the boots-on-the-ground heroes like Doctors Without Borders, that's MSF, who are providing care right in the middle of crises. And of course, you've got the major funders like the Global Fund, national governments, and countless local NGOs doing the critical work you never hear about. It's a complex web, and they all have different priorities. And, this whole thing isn't just a free-for-all. There is a kind of rule book. They're called the International Health Regulations, or IHR, and they basically provide a legal framework to help countries work together. The whole point is to coordinate how we respond to emergencies, to make sure information gets shared, and to stop a health threat in one place from spiraling into a global catastrophe. While pandemics totally grab the headlines, these ethical principles are being put to the test every single day in countless other situations. So let's look at how this stuff actually plays out in the real world. Let's talk about money. Resources are always limited, which forces some incredibly difficult choices. So imagine you're in charge of one big global health fund. What do? Do you pour it all into preventing the next pandemic? That's beneficence on a huge scale. Or does justice demand you spend it on treating chronic diseases like diabetes that are affecting people right now? Or maybe you focus on strengthening the basic healthcare systems that everything else is built on. There is no easy answer. And you can see these principles clashing in real crises. Take the Ebola outbreak. The principle of respect for persons was pushed to its absolute limit. Medically safe burials were crucial to stop the virus from spreading, but they clashed directly with deeply held local traditions for grieving. Finding a way forward meant building deep trust with the community. Now, contrast that with the fight against HIV/AIDS. The core dilemma there has always been about equity. How do you fight through patent laws, high costs, and logistical nightmares to get life-saving drugs to the world's most vulnerable people? And man, walking this ethical tightrope gets especially tricky when it comes to research, particularly when it involves vulnerable communities. To make sure no one is exploited, there are basically 3 non-negotiable rules. First, everyone who participates has to give fully informed consent. They need to know exactly what they're signing up for. Second, the study itself has to be designed to minimize any harm. And third, and this is huge, the benefits of that research have to be shared with the very communities that helped create them.
So, after going through all of this, it becomes pretty clear that this isn't just some academic exercise, right? It all leads us to a really powerful conclusion about our shared responsibility to build a healthier and, frankly, a more fair world.
Ultimately, if you take just one thing away from all this, let it be this. The work of global health isn't just a technical problem to be solved. It's not just about medicine. At its very heart, it's a moral project. The real goal is to build a world where that ethical compass, justice, equity, and respect for people is guiding every single decision we make about health. And that brings everything right back around to you and to me. In a world where a virus can cross the globe in a matter of hours, it's never been more obvious how interconnected we all are. Your health truly depends on the health of someone halfway around the world, and theirs depends on yours. So the final question isn't just for the big organizations. It's for all of us. What is our individual role in building that more equitable world?